So over the last 12 months, we've seen an unprecedented level of attention placed on aged care. We've had a Royal Commission, which has been focusing, obviously, on some of those worst examples of care that we have heard about in a small number of providers. What there hasn't been is a significant amount of attention on those positive stories, the things that we do really, really well in aged care every day, and in particular, those things that the public system do really well in Victoria. So the Victorian Healthcare Association, as the peak body for public aged care providers in Victoria, we're hoping to provide support to those providers that want to tell really positive stories so that we can remind our communities that actually the vast majority of what happens in aged care is really positive, and we're here to support people to live the best lives that they can. One of the things that we do really well in public sector aged care is focus not just on clinical outcomes and clinical care, but quality of life, making sure that those people who are residents in our public facilities enjoy as high a quality of life as they possibly can. One of the things that the Royal Commission has taught us is that there is a really significant interest in aged care from the community. What we have to do is start to redress the balance and show all of those positive things that happen every day in our residential facilities. We need to show just how much of a focus the public sector in Victoria places on quality of life, not just clinical care and clinical outcomes. And we need to remind our communities that we actually provide aged care in a really effective and a really positive way.